We welcome you to our module End-Stage Liver Disease, HCC 27 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of end-stage liver disease. At the end of this module, the learner will be able to differentiate among bone, joint, muscle infection and necrosis. Discuss the criteria for the documentation of these diseases. Identify the ICD-10 codes that fall under the purview of bone, joint, muscle infection and necrosis. Review the example of the assessment and plan for these diseases. Bone, joint, muscle infection and necrosis are caused by bacteria reaching bone, joint, and soft tissues by way of the bloodstream or other internal or external factors. Bone infection, also called osteomyelitis, occurs when the infection from one part of the body spreads to the bones through the bloodstream, while joint infection is called septic arthritis and muscle infection is known as pyomytosis. Necrosis, on the other hand, refers to the death of body tissue. In most cases, all of the aforementioned diseases are caused by a bacterium called Staphylococcus aureus. The bacteria may enter the body through bloodstream until it reaches the bones, joints and muscles to multiply and propagate. The symptoms usually include swelling in the infectious joint or bone, nausea, fatigue and fever. Infectious arthritis is often accompanied by a striking polymorphonuclear inflammatory response and can cause severe destruction of the articular cartilage if not properly diagnosed and treated. There is another disease associated with this HCC, named necrotizing fasciitis or necrotizing infection. It is a type of soft tissue infection characterized by extensive tissue necrosis and production of tissue gas. It may develop and progress with a dramatic speed, and extensive surgery and systemic antibiotic surgery are often required. The criteria for the documentation of end-stage liver disease include a physical examination, lab tests, and radiological studies. For the physical examination, the examiner should check for palpation of the abdomen, a positive indication of which is a hard and lumpy liver, jaundice, edema and ascites, splenomegaly, esophageal varices, bruising and bleeding, sensitivity to medications, itching, nausea, fatigue, loss of appetite, weight loss, weakness, spider-like blood vessels on the skin, etc. Usually, patients with abnormal liver function who develop ascites, variceal hemorrhage, hepatic encephalopathy, or renal impairment are considered to have end-stage liver disease, ESLD, therefore these diseases are to be checked too. Abnormal liver function test, abnormal liver enzyme and hematological tests should be conducted along with abnormal metabolic findings. Radiologic studies such as CT scan, MRI, liver scan and or an ultrasound of the liver and a liver biopsy should be conducted. Note that liver biopsy should only be done if the result has an effect on the treatment. Let's look at the ICD-10 codes associated with end-stage liver disease. For chronic hepatic failure without coma, the code is K72.10, HCC 27. For chronic hepatic failure with coma, the code is K72.11, HCC 27. For hepatic failure, which is unspecified without coma, the code is K72.90, and the HCC value is 27. For hepatic failure, unspecified with coma, the code is K72.91, HCC 27. And lastly, for portal hypertension, the code is K76.6, HCC 27. All diagnoses and causal relationships must be established in order for the coder to abstract properly. The assessment and plan should address the diagnosis and include two support indicators. Let's see an example of a progress note. Patient name: Glenn Johnson. Date of service: November 22, 2019. Date of birth: September 30, 1978. Assessment and plan: ESLD. Advised patient: no ethyl alcohol, healthy diet. Not a candidate for liver transplant. Comfort and support measures in place. Return to clinic monthly to manage symptoms. We have reached the end of our short refresher course on end-stage liver disease. We gave you a short introduction to the disease, identified the criteria for the diagnosis of ESLD, the ICD codes that fall under the disease, and finally reviewed the assessment and plan for end-stage liver disease. Thank you for joining us.